Good afternoon. You've joined us for Likeable Science. I'm your host, Ethan Allen, here on ThinkTech Hawaii, broadcasting from ThinkTech Studios in Pioneer Plaza. Likeable Science is all about how science is an integral, vital, and fun part of everyone's daily lives, and should be regarded as such, should not be feared, should not be a subject of trepidation, but should be celebrated and enjoyed. We're going to take a little bit of a slightly different tack today, although we get into a really core area of science, and the idea of systems thinking, which is central to all science here. I have with me in the studio today Mathew Nagato. Welcome, Mathew.
Thank you.
Good to have you here.
Thank you.
Mathew is a communications director for Hawaii Primary Care Association. It's a non-profit public health organization. But he's perhaps best known as the writer, director, and producer of now 2 documentary films. Ola, Health is Everything, came out last year.
April of last year.
And Ike, Knowledge is Everywhere, is just premiering
week.
now. Okay, so we're going to talk today a little bit about Ola and Ike.
Yes.
About sort of health and knowledge and how these ideas work, how these ideas are integral to the sense of community, how we have to think about these concepts very much tied in with one another, part and parcel of one another, not as discrete little entities. A little bit of background about Mathew. Since 1987, he's worked for a variety of healthcare organizations around Hawaii in various different roles, now focusing on sort of transforming healthcare systems, looking at bigger picture to get healthcare systems to support thriving, healthy communities, basically. He speaks regularly at a wide variety of conferences, meetings, healthcare organizations, medical symposia, etc., on systems transformation, innovation in healthcare. He was, in 2013, a TEDx Honolulu invited speaker, right? Okay. And his film, Ike, was on the 2014 International Film Festival. Excellent. So, super. So, give me just sort of the big, sort of what's your sort of central message here from these films?
I think on an intellectual level, both of these films are about sort of radically rethinking what constitutes a healthy society, and I think on a more emotional level, both films are a reminder and a celebration of the power of community to try to address some of society's biggest challenges. But ultimately, I think at the highest level, both films are about the interconnected nature of everything.
Exactly. I have seen Ola and was completely blown away by it. I have yet not seen Ike, only the trailer of that, but it's I was already blown away by that too.
Thank you.
Simply amazing films, and the message of Ola, where it is very much there are individuals out there working hard and dedicated, focused individuals, but the real power comes when multiple individuals begin sort of aligning their efforts together and working together as a community, and then sort of magical things happen.
Correct. Yeah. And I think, you know, when we were working on Ola, we had no idea what the reception would be like, and so in constructing Ola, we tried to make a very discrete film, a discrete universe, where the film would begin a conversation of these things called the social determinants of health, but also have an opportunity for us to, as you just mentioned, showcase individuals who are doing great things for their community, not necessarily for themselves, but for their community, and hopefully at the end of the film provide a call to action so that anyone who saw the film would feel, I can do something. I can do something for myself, for my family, my community. And so we created sort of this universe with Ola where we could have people watch the film and have conversations about what these social determinants mean to themselves and what they could then contribute to society at large.
Well, super. To get at that, let's go and show the trailer from Ola, and just to help our audience get a sense about what we're really talking about here. If we could pop that up. Okay.
Where you are in society determines how long you will live and the quality of that life. What affects one system, whether it's biological, environmental, social, psychological, affects every other system. We're not really taking care of the bigger issues that affect health and well-being.
It's not going to be an answer where you just pour money into healthcare. I mean, we've been there, we tried that. We spend more than anybody else in the world. It doesn't work. In fact, it's getting us into a worse situation.
We need to have doctors, we need to have healthcare, but we need to take a broader view.
We have to start thinking about community as sort of like organized community with a voice.
When somebody suffers, we suffer. When we heal ourselves, we heal others. That is our life.
Wow, so that was super to see that again. And again, I think you captured an amazing breadth of subject matter, and even that trailer, I hope, gives the audience some sense about what Ola dealt with. But so, how did you then? Why did you feel compelled to do another film?
You know, that's a very interesting question because. Although I've been in healthcare for almost 25 years now, most of that was spent in communications and marketing, but I never had any experience doing filmmaking, documentary filmmaking of any kind. And so
Stunning.
When we were making Ola, we really thought it was a one-shot deal, that we were just going to make this film and that would be the end of it. But almost from the very beginning, when audiences would come up after screenings, people would ask, are you going to do another film? Because I think there's a hunger for this kind of storytelling where it's not necessarily scolding people or trying to scare them into taking action, but rather using the example of others to inspire people to take action. I think inspiration is a far more powerful motivator than some of our other methods. And so people would come up and say, when are you going to do another film? And the big challenge is getting funding to make a film, because filmmaking is always very challenging, very expensive. But as time went on and as we screened Ola across the state and across the country, it became quite clear that if we didn't do a sequel, we'd have barbarians sort of at the gate. Where's the next film? Right. So, you know, as I described Ola earlier as sort of this universe that we sort of created in the first film, and so the idea for the second film was, let's take a galaxy within that universe and let's really zero in on that and try to explore that more fully, so that the films, both films, would share similar DNA perhaps, but we would be able to really tightly focus in on just one component of this larger universe that we talked about in Ola.
Right, and so the one component was sort of education. Learning.
Yes, and that stemmed primarily from the fact that of all the social determinants of health that we talked about in the first film, for me, I always knew that if we had an opportunity to do a second film, it would have to be education, because education is the social determinant from which all of our opportunity springs. So it was very clear that once we had an opportunity to do film number 2, it had to be education.
Excellent. Well, why don't we go ahead and look at that trailer for Ike then?
Okay.
Ike, knowledge is everywhere.
As educators and as professionals, we're all focused in the same direction. The difference is, though, we have different experiences. How do you provide common experiences for people to start to talk about things so that we can get everyone on the same page?
just attending college became such an elite and socially esteemed position where if you weren't from a certain social bracket or from a certain zip code, you know, you might as well forget it. You know, that's just probably not your pathway.
There's such disparity between private schools and public schools. The wealth component is obvious.
There is a problem in Hawaii with education. To have that kind of community, to have that kind of world, obviously is not functioning. I mean, we kind of live in that right now.
With committed individuals that want to make a difference at the schools is huge.
In reality, what we're doing is just helping kids get equal opportunity to sometimes change the trajectories of their families and hopefully trajectories of their communities.
We're really trying to enable and empower our students that education is life opportunity.
We're not just counting on one individual to make the difference, but it's the collective efforts of many make the difference in the lives of many students at once.
Okay, so that was Ike looking at, as you said, a galaxy within that universe, in the health universe. So you used the phrase, as we were talking earlier, there are social determinants of health.
Yeah.
And perhaps for our audience, you might explain that a little bit.
Yeah, social determinants of health. It's you know, one of those sort of awful phrasings that you wish some marketing person would come up with better branding for it, because when you say social determinants of health, I think people sort of recoil because it just sounds awkward and terrible. And social determinants of health really are all of the upstream factors that affect our ability to lead thriving, healthy lives. And by upstream, I mean we encounter these social factors before we have to actually engage with what people normally consider the medical system, quote unquote. It's sort of the infrastructure of sickness: health insurance, doctors, clinics, hospitals, technology, pharmaceuticals, all of those things that you only engage with once you're sick. And so for us as a society, I think one of the largest problems is we've spent so much time and energy and resources on the after effects, the medical system where people are already sick, as opposed to sort of looking upstream at all the social factors that influence whether a person was going to get sick and be in that situation. Okay. So these social factors are things like your education, your income, your housing situation. Do you live in a house, or are you living in a car on the beach or on the streets of Kaka'ako? What is your access to fresh, healthy foods, and what is your neighborhood like? Does it make you feel safe enough to be able to engage in healthy behavior? So all of those things constitute sort of the solar system of social determinants.
Excellent, excellent. And I can see, yeah, you begin to right away get at this whole issue that health is not a discrete sort of yes, you're healthy, no, you're not healthy. Correct. Kind of health is the result of a lot of different factors: physical factors, psychological factors, yep, environmental factors, yes, economic factors. Yes. All these things play various roles, and almost any one of them, if it's tweaked hard enough, can
upset everything.
Right.
And it's a very, I think, hopefully what people get from that is that health is a very complex thing. It is not a black and white issue that can be decided so very quickly in a very linear fashion. We need to look at, as I mentioned at the very beginning, sort of the interconnected nature of everything.
Yeah, we get back to this idea of systems thinking.
Correct.
And we're going to talk some more about systems thinking and its relationship to both health and education after we come back from a short break here. I'm your host, Ethan Allen. You're on Likeable Science. My guest, Mathew Nagato, the writer, producer, director of OLA, Health is Everything, and Ike, Knowledge is Everywhere.
Yes.
We'll be right.
Hi, I'm Jay Fidel. I'm host of Hawaii, the State of Clean Energy, which is our flagship show, which plays 4 to 5 p.m. every Wednesday. And the supporters of that show are Hawaii Energy Policy Forum and Hawaii Energy. And luckily enough, we have representatives of both of them right here today to tell you more about what they think about the show. Sharon Moriwaki at my left is co-chair of Hawaii Energy Policy Forum, and she goes first. Sharon?
Thank you. Thank you, Jay. I'm so glad that we have this Hawaii, the State of Clean Energy. This was 2 years ago when we started this, and we have continued it because it's so important, and there's so many developments happening across the state. And we hope you'll tune in every Wednesday, 4 to 5. It's wonderful.
And Ray is Hawaii Energy. Ray, what is your thought about the same subject?
Well, I agree completely with Sharon that we are talking about every Wednesday, 4 to 5. We talk about some of the most important subjects that are affecting the islands now and into the future. Energy, clean energy, we need it. We often run into new ideas that we had not thought about before. We did just today, and I think we're going to have more of that in the future. So come on down and watch us 4 to 5 on Wednesdays, and we'll see what happens.
We'll see you then. Aloha.
Aloha.
And you're back here on Likeable Science. I'm your host, Ethan Allen, here in ThinkTech Studios. With me today is Mathew Nagato, the writer, producer, director of 2 amazing documentary films, Ola, Health is Everything, and Ike, Knowledge is Everywhere. And we just saw in part 1 of the program here, we saw short trailers for both those films. I wish we could do both films here, but we don't have that amount of time. But and you referred to the universe of health and to the galaxy of education as being one of the key social determinants of health. So it seems to me there's a very tight sort of reciprocal relationship, though, that in that education certainly impacts health, but then health also impacts education, right?
Correct, correct. And you know, I'm probably going to be mixing my metaphors a little bit here, but the relationship between education and health is very straightforward. The more education you have, the longer and healthier your life is going to be. And we've seen this all across the country, all across the world, in study after study. And so thinking about education, again, mixing my metaphors, education really is sort of, if you look at the continuum of a person's life, it's sort of the Big Bang. It's the event, it's the situation in which everything that follows will be affected by, because if you can ensure that people have a comprehensive quality education, you reduce the likelihood that they're going to live in poverty. Once you do that, you open up opportunities for people to live in a better neighborhood, to have access to healthier foods, to feel more educated about health-related issues, and therefore more motivated to go out and engage in healthier behaviors, exercise, and more empowered to do these things. And so if you look along that continuum of a person's life and you trace back every social situation that they've been in, education is at the very beginning of it all. It is, in a lot of sense, the golden ticket to people being able to live a thriving and healthy life.
Exactly. There's wonderful data now coming out from some of the early Head Start studies when they did some very intensive Head Start interventions with kids.
Correct.
And these kids are now in their 40s.
Yes.
And what they're finding is not only, they knew in their 20s already these kids got more education, they went further in school, they were less likely to drop out, they were more likely to have a better job, they had higher incomes, they had less social ills, lower divorce rate. But now in their 40s, they're also finding these people are healthier.
Yes.
They have less heart trouble,
Yes.
they are more nearly normal weight, less obesity, less diabetes, a whole slew of, so yes, we
Absolutely. And I think, you know, here we just sort of had this great debate about pre-K in the last election, but in looking at education as being the golden ticket that we know enables people to lead these thriving, healthy lives, that golden ticket gets printed in pre-K. It is your early childhood development that sort of sets your educational path.
Right.
And your educational path then sets the whole entire course of your life. So
indeed, some would argue it gets printed while in utero, basically.
Right. Exactly.
But certainly very early in life, yes,
Yes.
much of this is indeed because when you're both developing in utero and early in life, your brain is growing at a
Yes.
tremendous rate, developing synapses truly at a rate that will never do after that.
Yes.
And that's going to determine your ability to learn. And if you have insults at that point, whether through sensory deprivation, whether through psychological misfortune, whatever, or toxic exposure, you will not, your brain will not develop correctly, will not develop to its full potential. You will lose out on a whole slew of things, and these, then begin to have ripple effects down the road.
Absolutely.
Yeah.
Absolutely.
So what came, what was the driving need that sort of started you down this path? I mean, you said you hadn't done any of this work before.
I hadn't.
So how did you get going on this?
I like to joke around and say the universe just wanted to make sure these films got made, because I was, one of the least likely people, I think, to be in this situation. But honestly, it was just being in the right place at the right time and meeting the right people. But both of these films sort of owe their legacies to a very specific individual that we lost last year, the late director of the Department of Health, Loretta Fuddy. She had a long career in public health, and upon arriving as a director of the Department of Health, did something very, very radical, which was to enshrine within the strategic objectives of the Department of Health this notion that social determinants be an integral part of what they do in public health. And so that sort of opened the door to explore alternate ways to engage community and talk about issues beyond just public health. And so it was her green-lighting the project and having a conversation with me about the recognition of the need for those of us who work in healthcare to sort of extend our hand out and begin this sort of chain reaction of creating partnerships with people in education, in housing, in transportation, energy, the environment, to start sort of this process of let's look at health from a global, a universal perspective. And I'll never forget, she said something to me about, we were talking about how do we, what is the core message of the first film going to be? And she was talking about the sense of community that I mentioned earlier, how important it is, but that we had been slowly losing the sense of community over time as we sort of hyper-individualize our society with our technology and so forth. And I'll never forget, she said, when a natural disaster happens, you never have to tell people to go out and help their neighbor. People just react instinctively.
Right.
Whether it's a volcanic eruption or a tropical storm or hurricane, people will naturally go to the aid of their neighbors when it's a natural disaster. But when it's a man-made disaster of our own making, whether it's the healthcare system, the housing situation here in Hawaii, or transport, all of these man-made disasters that are now interacting with one another, people are not reacting in the same way.
We don't view them in some sense as disasters. They don't ring those emotional alarm bells in the same sense.
Yes. And so how do we harness the power of a documentary to try to get people to understand that they do need to have those alarm bells going off? Yeah.
And certainly, yes, it's a very powerful film that really does. It has tremendous emotional impact on you. You sort of gasp as you watch it. And no, that's again, it gets sort of to the power of stories.
Yes.
To move people, and it puts a very human face back on this seemingly sort of social determinants of health, this impersonal sounding term, and on this rather large, complex, seemingly depersonalized healthcare system.
Yes.
You focus in with some clean, very pretty stories about individuals, what they did, the very inspiring acts they took, their dedication, to make their communities better places to live, to do one little piece of the pie, and then somebody else did another piece of the pie.
And I think a lot of it was stories of selflessness, not just thinking about my own circumstances, but what can I do for the people in my community who I see are suffering from certain things. And every one of the 3 stories in Ola is a perfect example of that. Someone looking around in their community, and in those 3 cases in Ola, it was adopted communities. Those people had not been born and raised there, but had arrived, looked around and saw a situation, whether it was education or housing or access to fresh, healthy foods, and said, I can do something, so I will do something.
Wow.
Yeah.
And really amazing that it should be people who are not native to that community,
Correct.
but had moved in.
Correct.
And whether is that outside perspective needed so they can see the problem more clearly, or is it?
Right, and I think one of the themes we talk about in Ola is that, and that was very personal to me, a message I wanted to make sure was in the film, is that only in a place like Hawaii could you have a situation like that where a complete outsider would come in with outside ideas and yet still be embraced because of this sort of sense of ohana that we have. You know, it might not be as strong as it was in the past, but it's still there, and it enables us to work together when the situation calls for it.
It is, and it's so critical to Hawaii's success.
Yes.
And Hawaii is basically still a small island.
Yes.
And the lessons that if our compatriots on other small islands in the Pacific have taught us anything, it is that sense of community is absolutely critical to long-term stability and survival on islands.
Yes. And
the sense of individualism, which is a very powerful and had been a force for a lot of good in mainland U.S., certainly has a role here, but the sense of community needs to be probably at a higher level here than there.
Absolutely, because I think one of the things that it's very easy for those of us who sort of live in modern times, very easy for us to forget that we are, all of us, the descendants of travelers who came to this island, whether it was very recently or many, many, many years ago. And it doesn't really matter how we traveled or our ancestors traveled to get here, but when they arrived, they understood very specifically that they needed to work together to create a sustainable community, a sustainable society on these very small islands in the middle of the Pacific Ocean. And those are lessons that I think are very important for us to remember.
Right, the classic Hawaiian saying, the island is the canoe is the
Exactly.
island. Making that strong parallel when you're out on an ocean-going canoe with a handful of other people.
Right.
You're very interdependent.
Yes.
You absolutely must rely on your neighbor to do their job, and they must rely on you to do yours, and you can't shirk your duty, basically.
Correct.
Because that hurts the whole community in a very, very serious way. And similarly on an island, and I think maybe that's sort of a growing awareness that indeed that's true now on a global level. As we are more and more connected, we realize, yes, we live on this small blue island floating in space, but we're all basically on the same little island, and there's no getting off of it, basically. And,
Not yet, anyway.
And what each of us does impacts more or less our neighbors everywhere, and science is teaching us more and more just how those impacts travel around the world. The waste you put out today finds its way into somebody else's body tomorrow, and that goes on and on. So it's got to be taken into account and become a way of. So this Pacific Island value of community really should be promoted, and indeed, I think your film certainly does that.
They are definitely, I think, at the cornerstone of the roadmap of how we're going to navigate our way into the future. Looking back at those lessons, absolutely.
Yeah, exactly. And again, I think I don't mean to harp on this, but I do think your idea of systems thinking that lies at the heart of both of these films is very important here to understand.
Yes.
You can't take a complex problem like health or like education and say, let's do X, Y, and Z, and those 2 or 3 things will fix it all.
Fix it, yeah.
No, they are, both of those are shaped by a myriad of social factors that themselves each impact one another, too, in a very complex network, and any tweak you put on one causes impacts on the others. So there aren't simple fixes. But we'll find some simple fixes when we come back after our next break here. You're watching Likeable Science. I'm your host, Ethan Allen, here on ThinkTech Hawaii. With me today in the ThinkTech studios is Mathew Nagato. We're talking about Ola and Ike. We'll be right back.
Ted Ralston, folks, host of our show at ThinkTech Hawaii called Where the Road Leads, where we talk about technology influencing the future of Hawaii. Technology, of course, is the art of solving problems. We always bring in interesting and informed guests who can see from different perspectives and different points of view how that future might unfold and how technology can assist us in getting there. So once again, join us 4 o'clock to 5 o'clock on Fridays. Ted Ralston, your host. And please, if you have ideas that you'd like us to address on this show, or folks who you think should be on it, let us know.
And you're back with Likeable Science. I'm your host, Ethan Allen, here in the ThinkTech studios. With me today is Mathew Nagato. We're talking about his 2 documentary films, Ola, Health is Everything, and Ika, Knowledge is Everywhere, talking about the way these films very much drive home messages of connectivity among people, among people and communities, and among all the different aspects that make up the people in the communities. People's health, their well-being, their education, their economic stability. All these things play together so deeply and in such an intricate, interwoven way. So, tell me a little bit about what your challenges were, I guess, in getting these things going.
Well, the first challenge is that I'm not a filmmaker.
Easy to get past that. You obviously did very successfully.
Really, I mean, the first challenge was when I was approached with this idea to do the film. I did not want to do it because it was such an important project. I didn't want it in the hands of someone who had no experience.
So why was it decided that it should be film? Why not an advertising campaign, posters,
You know, I think, again, I go back to Deliana Fuddy, the former director of the Department of Health. An advertising campaign, posters, things of that nature, that's sort of in the standard toolbox of public health, right? Quit smoking, stop drinking sugary beverages, that kind of thing. But I think Deliana really understood that this was a much more complex message, as we were talking about. And so we needed to take a step back and re-examine what the best method of communicating this very complex message was going to be. And I think a lot of the folks who had talked about doing a film about health in Hawaii drew their inspiration from a PBS documentary called Unnatural Causes, which was about the social determinants of health, sort of at a national scale. And there had been many discussions over the years, let's do a similar thing for Hawaii. And so I think those two things combined, Deliana's vision that we really needed a different vehicle to communicate a complex message, as well as this desire to have a Hawaii version of a PBS documentary. Those two things sort of created the circumstances where they said, let's make a documentary.
And then you happened to be
and then I happened to be
in the meeting.
I happened to be the person standing in the line, and everyone stepped back, and there I was.
But you said you found a videographer.
I found an amazing crew, cinematographer and production crew, and so again, it was finding the right people to be able to help me as a novice sort of navigate my way through creating what was shaping up to be a very important part of the Department of Health's strategy for increasing awareness of social determinants. And then it was a matter of us finding people to tell their own stories about what they had been doing about various social issues across the state. And that presented some challenges because, you know, when you talk to people and say, we're going to bring a camera crew, we're going to be following you around for days, and we're in your house and at your work, and it is a little intimidating.
Sure. I'd imagine you must have had some false starts there.
We did. We had some folks who, were doing really great things, but just couldn't see themselves sort of being put in that situation of being up on film. But what we found was the 3 stories in Ola and all 4 of the stories in Ike is people are natural storytellers themselves.
Sure.
And so I think it was just a matter of convincing them that talking about what they had done to do good in their own community, talking about it on film could do much greater good for all communities. And that's sort of the tipping point at which they say, okay, you can come and sort of invade my life for a couple of weeks.
Excellent, because that then helps make build a sort of social acceptance, a social awareness. It becomes a good thing to do. You're supporting public health. You're being an active force for good. And that's that kind of social awareness of the good or bad that's being done is so critical. I worked for some while in the inner cities of Chicago, and the education system, the K-12 system, had failed a great number of people there. A great number of students failed courses there, failed school, and school fundamentally failed them. And many of these people stopped believing in schools, and then they would not support their neighborhood schools when their kids were in them. And so these schools then had disengaged parents, disengaged students, parents who believed their kids were going to fail, kids who believed they were going to fail. And there was a sort of continuous cycle of negativity that was really driving a very vicious cycle. And you need to get that kind of break where you get somebody to come in and say, hey, you know, this is a good thing to do. This is positive. We're gonna succeed. You can succeed.
And you know, there are a lot of examples of that here in Hawaii. A lot of our rural communities, they suffer from generational poverty created by some of the situations they're talking about. Where if I, as a parent, have a bad educational experience, I'm not going to look very positively on education, just sort of in general. And so their children then become stuck in sort of that cycle. But in EK, there are a couple of programs that we showcase where organizations have taken it upon themselves to try to break that cycle of generational poverty by showing both the students but also their parents that there is a different way, and that education is not something that need be feared. And you don't have to sort of make that very difficult choice of, can I afford to be educated or not? And those were perhaps some of the more inspiring stories in the second film.
Yeah, it is interesting the way different communities come to view education.
Yes.
When I left Chicago and went to Seattle, I ran into sort of the opposite problem, in that you would talk to the successful Boeing engineers who wanted the schools to be exactly like they had been for them, because these schools had clearly succeeded with them and made them these successful people. So they questioned any change in the schools because they wanted to be sure their kids got every bit as good an education as they had. And you had to prove them that your change was going to be better. You know? And that's sometimes a very tough thing to prove. So, yeah, it's a tricky business.
It is. And you know, trying to tell these stories in a documentary format is in and of itself a tricky business, because you've talked about the emotional impact of the film, and you don't quite get that when you try to condense a very complex subject and a very complex personal story into a 3-minute video that just kind of goes up on the internet. These stories have to be told in this format for people to sort of have the cumulative effect of both the message of interconnectedness as well as the inspirational call to action, I feel.
Right. Your film creates a context that makes the stories come to life, makes them memorable, makes them vivid, puts them in a meaningful place and sort of format for people to grasp them, hear them, feel them in their heart.
Feel them, yes.
Yeah, yes. What was I was hearing the other day, the expression is, explain to me and I understand, show me the data and I'll believe you, tell me a story and it'll live in my heart forever.
Right, and that's similar sort of ethos that we followed in the first film and carried over to the second film, was that Maya Angelou statement about people will forget the things you've said and forget the things you've done, but they'll never forget how you make them feel. And so I've come to really understand and appreciate not just the value of storytelling, but making people, or trying to get people to have an emotional reaction to those stories, because once they feel those things, they walk out of a screening and they carry that with them, and it motivates them to make changes in their lives and do great things.
Yeah, interesting, and very powerful. I would certainly believe that your films have that power, because they were, although it's certainly a deeply moving film, and I think that the two together are going to be a dynamic duo. So, so I guess then that brings us to the question: is there going to be a follow-up?
Is there going to be a third film?
And if so, what's it going to be?
Well, you know, the biggest challenge with Ola was that, and as I said, I was a novice. The biggest challenge with the sequel, with EK, was resources. Very expensive to make film in Hawaii. But we were fortunate enough to have, again, as a partner, the Department of Health, to help underwrite a portion of the film. So I think the challenge will be, are we able to not just inspire and motivate individuals in their communities, but are we able to inspire and motivate funders to underwrite a third film? I think that if there is a third film, and if I had to say with certainty today, I would say that there probably will be. It might not come as quickly, because Ola was released last year, and here we are, and just a year later releasing the second film. I think it will probably be a little bit longer interim, but if there is going to be a third film, I would say it's probably going to be about housing, because that is sort of another one of the very key social determinants of whether or not people can live a healthy life. And in Hawaii, we have an incredibly complex housing problem that needs to be addressed. So I would say the third film will be about housing.
Excellent.
Yeah.
that should absolutely be super. So how do you judge the success of these films?
Yeah, I had no expectations going in for the first film, because having never done it. And the success, I think, of the first film for me was having people come up after screenings and tell me directly how touched they were about whatever it is that they saw. Secondarily, it was hearing from people later on, weeks, sometimes months later, saying, because of what I saw in the film, this is what I decided to do in my life or in my community. And so that sharing that happened from people saying, I didn't just see your film and get it and understand it, it motivated me to do something. It touched, it activated something within me. That really became sort of the metric by which I decided whether or not it was successful. And so for EK, it just premiered last year, last week at the festival. So I think I'm going to use the same sort of barometer and seeing how many other people get affected by the second film.
I'm sure there'll be legion. It's stunning. So just in hearing you speak, it just brings to mind that we should actually chat further here about this, because there are groups at for instance, the National Science Foundation who support media projects. And I think with some good examples under your belt like this, that they'd be very interested in looking forward to see about what could be done.
Well, I think if people see Ola, they'll get the message without necessarily having to see EK. Likewise, if you watch EK and have never seen Ola, you'll also get what we're talking about the interconnected nature of community and the importance of all these things. Ideally, you would see both. And perhaps in doing so, that might motivate people even further to really dig deep and explore some of these issues within their communities.
Yeah, I really think it could, and if you can get that kind of energy going in communities and get multiple individuals inspired sort of together in a community, a particular community that needs, has some deep needs, then you have some possibilities for truly transformative change, to really turn a community around, to reinvent themselves, to recreate themselves, as it were, in a new, improved version.
That's definitely not, in our wildest dreams what we had thought would happen, but it is beginning to happen, and that's sort of been the greatest satisfaction out of this entire process, is seeing that unfold.
Yeah, I know, and it seems to me you've got great vehicles here to do that, because the ways in which you've addressed this through telling these very inspiring stories are perfect vehicles to help generate that self-efficacy, to realize, hey, that guy there, he wasn't anyone special.
That could be me.
Yeah, that could be me. That could be my neighbor. We could work together and do this kind of thing. It wasn't Superman who did that.
Right. I mean, that was the hope, is that when people see the film, they don't necessarily say, well, I can't do that. I'm sure I might not be able to do that, but I can do something.
Right. Gee, that puts me to mind, here's my particular talent, or here's a set of resources that I could bring to this problem. And maybe if I talk to my friends over here, and so over here,
they will be similarly motivated.
Yeah, we can bring together sets of resources that can really get this. Wow. Amazing. Utterly amazing. I'm stunned and more impressed than ever. Mathew, it has been so good talking to you here.
Thank you.
We're unfortunately out of time, so we're going to have to call it a day here, but this has been great. Mathew Nagato, the writer, producer, director of Ola, Health's Everything, and EK, Knowledge is Everywhere. Amazing fellow. Thank you so much for being here and sharing your wisdom and insights on likable science.